Welcome, everyone. Thanks for joining. We're going to give it just a minute longer before we get started this evening, making sure everyone has no trouble logging in, and everyone who wants to be here tonight can be here. Thank you so much for being with us. Hi again. We had another big group join. Thanks for being with us here tonight. I'm just doing a few things here, allowing some others to join on, and we'll get started in under a minute. All right, good evening, everyone, and thank you for joining our Men's Health webinar. I'm Brittany. I will be your host and your moderator. We'll start with a few housekeeping items, and then I'll introduce our speaker. First, your attendance tonight is completely anonymous to other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speaker. If you wish to ask a question, please type it in the chat box at the lower part of your screen, and we will be sure to include them during the Q&A session after the presentation. Our presentation tonight will last for approximately 1 hour and will be presented by Dr. Gregory Andros. Dr. Gregory Andros is a native of the Des Plaines area. He received his Bachelor of Science degree from the University of South Florida. He received his medical degree from Loyola University Stritch School of Medicine, and Dr. Andros completed his general surgery internship at Loyola University Medical Center in Maywood, Illinois. He completed his urology training at VA Hines and Loyola University as well, including a 6-month rotation in pediatric urology at Children's Memorial Hospital. Dr. Andros is certified by the American Board of Urology. I'll go ahead and turn it over to you, Dr. Andros.
Well, thank you, Brittany. I appreciate the nice introduction. So as Brittany mentioned, I'm Dr. Gregory Andros here with Advanced Urology Associates. We're going to be talking about BPH, or benign prostatic hypertrophy. So some more housekeeping here. So we encourage an open dialogue among participants, and privacy and expectations are going to be respected. So we want to ensure that no one is recording or taping this event. So my practice is located primarily in Joliet, but also New Lenox and Morris. I'm in a group with 8 other providers, urologists, all board certified. And most of us treat prostate enlargement. So if you see one of my fellow partners, many of the things I'll be talking about, they'll be capable of performing as well. So I do have some special areas of interest. By training, I am a general urologist. I do pretty much all of urology, male, female, and even some pediatrics. But I do have some niches, the vasectomy reversal procedures. I treat overactive bladder or incontinent problems, BPH therapy, and prostate cancer. So tonight we plan on covering what the prostate gland is and what it does. We're going to talk a bit about the enlarged prostate and how that occurs and what that causes in men as we get older, and some of the newest treatment options and how we handle that type of problem. So prostate overview. The prostate gland sits right under the bladder. And when we're in our 20s to 30s, it's about a walnut size. It does surround the urethra, and that's where the problem becomes an issue. As the prostate grows, it can push up on the bladder and compress that urethra. Now, the purpose of the prostate is to produce some of the seminal fluid that's required for sperm activity during ejaculation. The prostate does grow to its adult size in our early 20s, and it continues to grow after our mid-40s for the rest of our lives. So as we get older, the prostate becomes larger, and some of the symptoms from that enlargement becomes more prevalent. So the different conditions the prostate can cause in men is the enlarged prostate, or we often call it BPH, prostatitis, which is an inflammatory condition of the prostate, which could be from infection or other causes, and prostate cancer. And each of these conditions are independent. One doesn't cause the other, but you can have more than one and even all three of these conditions in the same patient. So we're going to go over the benign prostatic hypertrophy, or BPH. So what is BPH? Commonly known as enlarged prostate. So when the prostate grows larger than normal, it can cause BPH type symptoms. So the normal adult sized prostate we talked about in the ages of 20 to 30 is approximately 1.5 inches in diameter, roughly a walnut size. But when the prostate grows larger than that, it can start to lead to bladder outlet obstruction, which essentially means it blocks the opening of the bladder that we need open to urinate through. When this becomes obstructed, this leads to our symptoms that we get. We call this collectively lower urinary tract symptoms. It could be a slow stream, it could be spraying of the urine, it could be an intermittent stream that stops and starts while we go. It could be waking up at night to urinate, or even the feeling of not emptying the bladder completely or not even urinating at all, which is a complete obstruction. So BPH relations to prostate cancer. Well, BPH is not prostate cancer. They both can grow in the prostate, but benign prostatic hyperplasia is benign growth, not cancer growth. BPH does not cause prostate cancer. BPH symptoms are similar to those of cancer when there's obstruction. Sometimes we could have symptoms from prostate cancer that could be similar to BPH. So that should always be checked for when evaluating a patient for urinary tract symptoms. BPH may coexist with prostate cancer. That's why we always need to check for that when we do evaluate men for BPH. The PSA, the prostatic specific antigen, which is a blood test we often get in men annually to check for prostate cancer. These levels alone do not distinguish BPH from prostate cancer, because both BPH and prostate cancer can cause those levels to go up. That's why our prostate exam is very important in evaluating patients for prostate cancer to help distinguish an elevated PSA from an enlarged prostate or possible cancer. So the normal versus the enlarged prostate. As the prostate enlarges, pressure can be put on the urethra and also the bladder directly upward, causing the lower urinary tract symptoms. The prostate size, however, does not always correlate with the degree of obstruction or severity of symptoms. If men have more of an inward growth or an upward growth of the prostate, that can cause a more significant obstruction because the urethra is in the center of the prostate. If the prostate grows more outwardly, you can have a larger prostate without having an obstruction. So there is a corollary. With the bigger prostates, there is a higher risk of obstruction, but there are many men who have smaller size prostates with inward type growth causing significant blockage of the bladder. So what are the symptoms of this enlarged prostate? Well, some men will get that frequent urination. They have to go more often and more urgently both day and night. And that sudden need to go to the bathroom, we call urgency. You can have discomfort and burning if the obstruction becomes more severe. A weak flow or a slower flow is a common sign of blockage. And after urination, patients have a sensation that they still need to go. They walk away feeling not quite empty, and often 10, 15 minutes later, they have to go back and go a little bit more to completely empty out. And they often can have trouble starting and stopping the urine flow. It may have to stand there for a period of time just to get enough pressure in the bladder to initiate urination, and sometimes find themselves straining to urinate to get that urine through that blockage. And if it gets bad enough, if the blockage becomes more severe, patients simply cannot urinate. This does become an emergency. Often, if our urology office is not open, our patients must proceed to the emergency department and require catheterizations. So BPH is a very common condition. And if you break it down, up to 95% of men with moderate symptoms are unhappy and don't want to spend the rest of their lives with these symptoms. So the symptoms are quite bothersome to both our quality of life, but also can impact the health of us. It can affect our kidney function, and if untreated, the enlarged prostate can lead to permanent bladder damage. Studies also show that 49% of men experience sexual problems associated with the lower urinary tract symptoms. So this is also something that is very important for us to monitor. And 51% of men say BPH interferes with aspects of their normal life. This might be not traveling to certain areas because you're worried about the travel time and access to bathrooms, or waking up at night multiple times, impacting your sleep and feeling tired and fatigued. So these types of things can affect our quality of life. And BPH also affects men's partners' quality of life, because when men wake up 2-3 times at night, often their spouse is waking up with them. Or if they're pulling over because they're on a road trip multiple times, it affects their family and their spouse's life as well. So who can get BPH? Well, BPH is the most common prostate problem for men over the age of 50. At 50, our prostate is growing, and it continues to grow for the rest of our lives. Now, this can affect 50% of men by the age of 60. And then by the time we get to 85, 90% of us men will have BPH with LUTS, with lower urinary tract symptoms. In a study in 2010, as many as 14 million men in the US had the lower urinary tract symptoms. And we do see a higher risk of BPH with obesity or higher body mass index, called BMI, and lack of exercise. So these two factors can have a negative impact on our enlarged prostate. So how is enlarged prostate affected, and how do we manage that? Well, it's important that we get a very thorough medical history and physical exam. The prostate exam is the basic evaluation of BPH, or the enlarged prostate. We call this the digital rectal exam. It's the old finger check of the prostate. And again, we do this to differentiate between the symptoms coming from enlargement versus cancer. Urinary output testing is a more sophisticated test that we do right in the office. It's pretty simple. Something called peak urinary flow. Essentially, the patient would urinate into a flow machine, which is in the toilet system of the urologist's office. And this measures the flow rate. So this way we can get more objective data on how the flow is. And we know what normal flows are, and we know what obstructive flows are. And this helps quantify that. And then after emptying the bladder, we like to get a post-void urine volume test. This is that bladder scanner that we do when we check the bladder to see how much is still left inside the bladder, and tells us if there is incomplete emptying secondary to a blocked prostate. Now, a lot of symptoms, people will say, yeah, my urination is bad, or I have really weak flow, but it's hard to quantify that from patient to patient. So we use these questionnaires that we have our patients fill out in the office. And there's a few of them out there. One is the American Urologic Association Symptom Index. One is the IPSS. There's also a quality of life questionnaire and a bladder impact index. Essentially what these do is just help quantify for the urologist, how blocked are you and how bad are your symptoms? And it's usually a 1 to 10 or 1 to 5 questionnaire as far as how bothered you are with these symptoms. So what treatments do we have? Well, the treatment options have changed dramatically in the last 5 to 6 years. In the past, surgery was the primary surgery or primary treatment for this condition, which was most of the time done in the hospital, sometimes with a 1 to 2 night stay. Well, in the last 6 years, a lot of innovation has been put into BPH treatments. And luckily, we have most of these FDA approved and covered by Medicare that we can treat patients with. So we always start with this easiest thing or the lowest hanging fruit, if you will. The first is behavioral modification. Well, that means change what you eat and when you eat and what fluids you drink and when you drink them. We don't recommend drinking 8 glasses of water at night, but we do want you drinking 64 ounces a day, which is roughly 8 glasses a day, but drink them more early and not late. This way you're not waking up multiple times throughout the night. And the choice of liquids, you don't want to have too much caffeine. The caffeine will stimulate the bladder pressure, which will cause more frequency, more urgency, and more getting up at night. Watchful waiting, this is essentially monitoring the symptoms. If they're mild, then we don't have to be aggressive with therapy, but we know the prostate's growing, so we keep an eye on it. And it's important to watch it, but not watch it to the point where there's bladder damage. We learn through studies that when the prostate grows and it's not effectively treated, this back pressure created by that blockage can cause permanent bladder damage. When this occurs, you often see these older men wearing diapers and Foley catheter bags because their bladder is now dysfunctional. And most of the time it's past the point of fixing that. So we want to be proactive in treating the enlarged prostate when the symptoms become significant enough. Often we'll have patients do Kegel and bladder retraining, which is good. And it's more helpful after a treatment than before, because the reason the bladder is getting this way is because of that back pressure from a blockage. So you need to treat the blockage to prevent that from getting worse. So we have things called the first line therapy. This is the first things that we do in actually treating the enlarged prostate. We do have prostate medications. We have the Rezūm Water Vapor Therapy. We have the permanent implant type procedures. And these are some of the newer technologies in how we treat the enlarged prostate. And if it's more progressive or the prostate's more enlarged with a higher degree of blockage, we'll often go to the surgical procedures, which include the GreenLight laser therapy, the TURP, which is the surgical scraping of the prostate, and even removing the prostate through an incision if the prostate is larger. So to go into more details of alternative medications, there's a lot of herbal supplements marketed and advertised in magazines, on the TV, on the radio, about how to treat the prostate with some over-the-counter magic vitamin or supplement. And this has been researched, and we've researched multiple components in how to treat the enlarged prostate. And these are big studies, placebo-controlled, double-blinded, which means this is the standard that we use all treatments, not just for prostate, but all types of medications. And they have not come up with any conclusive improvement with any of these supplements in really preventing BPH. So you may get some symptom relief, but you're not fixing the problem. And this does include saw palmetto, which is a popular one. So watchful waiting, again, this is more or less just modifying your lifestyle. This is really mild symptoms. Often we'll see this in men in their 40s and 50s, and we try to take the conservative route when the symptoms are not severe. But this does alert both the patient and the urologist that we need to keep an eye on this. If it's not getting better or the symptoms continue to get worse, then we already have a plan in place to move forward to treat this. So it is lower risk, but again, it doesn't fix the problem. We're more in the monitoring stage of the enlargement of the prostate. Because we know the prostate never stops growing, we are anticipating it's likely going to get worse. So we just have to keep on it. So medications, well, we have a few options with medications. We use the alpha blockers and the 5-alpha reductase inhibitors. Um, what this does, it helps relax the muscles in the bladder and the prostate, which helps open the channel. What the pill doesn't do, the alpha blockers, it does not stop the prostate from growing. So the men could have continued enlargement of the prostate, continued symptoms, and even bladder damage if the symptoms aren't picked up early enough. And it can continue to get worse as far as causing permanent bladder damage. There's also side effects, as there are with all pills. One of the things we really worry about is the drop in blood pressure with these medicines. One medicine, the generic, is tamsulosin. It's a very good medicine, probably one of the best that we have for the prostate. But when men stand up very quickly, they can get lightheaded and actually pass out if it's severe enough. So we don't want any dizziness or fainting or fatigue. If there are these symptoms, often we stop the medication. The other medicine I mentioned was the 5-alpha reductase inhibitor, finasteride, also used to known as Proscar. This helps slow the growth of the prostate down. It really doesn't stop it, and it helps shrink the prostate down. This works through the hormone system. It is a safe medicine. However, it doesn't always work with the smaller block prostates. It often takes 6 months to even a year to actually work. And there are a lot of sexual side effects with this particular medication, and even lowering testosterone levels and causing symptoms of low testosterone. So often it's not a bad medicine, but long term it's not very successful. So one of the newer minimally invasive therapies that we do to help treat the enlarged prostate is the Rezūm Water Vapor Therapy. So this is a therapy that we do right in the office, and we can do it under a twilight where you're out with a little sedation, sort of like a colonoscopy type anesthetic, or even just numbing the area and you're awake during this. The treatment doesn't take more than 15 minutes or so, so it's a relatively quick procedure. When we do this procedure, we're using water vapor. We actually inject water vapor pockets into the prostate. This shrinks those pockets in the prostate, which opens up the prostate channel. And this is done without any permanent implants or any surgical removal of the prostate. That's why it's safe to do in the office. Now, afterwards, there's some discomfort with urination. There can be some blood in the urine. Because we're shrinking the prostate and we're treating the prostate does produce some of the semen. You could see some blood temporarily in the semen. It can have an effect on the ejaculatory volume, where the semen volume goes down. Urinary tract infections can occur. We often give antibiotics for a short course afterwards to prevent that. And also the inability to urinate or completely empty the bladder. When we first treat this prostate with the water vapor, the prostate does swell a little bit, and it does take a full 3 months for the shrinkage. So it does work slowly, but the nice thing after that long term, it works very well. And this one-time treatment can often last, 5+ years. So when we do this treatment, I'm going to show a little video that shows how it works. It shows how the steam is injected. And when you look at the before picture above and the after below, it shows where the area is injected. It shrinks those pockets, which opens the channel, and that alleviates the blockage. So we'll take a look at that right now.
And Dr. Andros, I think you can hear me. We may not have sound on our end. If you could talk through this illustration.
So here's steam into the prostate. And that steam shrinks that part of the prostate without damaging the urethra. So essentially what the video is showing is how the Rezūm steam therapy shrinks the prostate without cutting into the prostate, but using a small needle that injects the steam into that area. There's no permanent implant left in the prostate. And because we're not cutting and destroying the prostate anatomy, you're not affecting the prostate function. So it doesn't affect erectile function or other sexual function outside of lowering the ejaculatory volume to a certain degree. And after the treatment is complete, there's very little discomfort and there's very little downtime because it's not a surgery. Men could walk, be active, and do their normal activities the next day. All right, so here we have another video that's going to talk a little bit about patient's response. This is one particular patient, Joe, that went through this therapy. Let's see if the volume is working on this one.
Yeah, we apologize. I'm not getting audio, so I would imagine that others aren't getting audio, Dr. Andros. So feel free to just move along to the next slide. And this video can be found on YouTube.
Okay. So essentially what Joe was talking about, I apologize, the volume's not working on the video. That's some of this technology these days. But essentially he just goes across what we were talking about. It's not a hard process to go through. I do all these treatments from the surgery in the hospital to the office-based procedures, and there's definitely a big advantage for the office-based procedures. The caveat is, the office-based procedures are not as invasive. So we have to do these treatments earlier on in the symptom progression. If men wait too long, they could be beyond the effectiveness of these minimally invasive treatments. So that's why we're more proactive in how we treat these patients. So that's why we don't want men to progress to the point where they're completely blocked off, where they're having severe LUTS, lower urinary tract symptoms. So we want to intervene earlier, not later, okay? So to go on to another option that we have in the office, it's the prostatic urethral lift or implant procedures. And this is also an outpatient procedures. We place permanent implants that stay in the prostate, almost like a stent, like that we use in a heart if there was a blockage there. So it no longer blocks the urethra. This one, I also do it usually with a twilight sleep in the office. It does have a permanent implant that always stays in there. It doesn't disappear, doesn't go away. And there is about a 13.6% surgical retreatment rate after 5 years. So it doesn't last forever. So after a certain period of time, the prostate continues to grow. It may reblock the bladder. And then they may need another treatment of some other sort. There is some side effects with painful frequent urination. For a period of time, there's blood in the urine. There can be some pelvic discomfort. The urgency of urination gets worse initially. You can develop urinary stones in the bladder, inability to urinate or completely empty the bladder, and painful ejaculation. Most of these usually occur during the healing process. But as we do the Rezūm, this is done in the office. Patients go home the same day. So it's considered still one of those minimally invasive treatment options. And then we have the GreenLight laser. And often this is a treatment that we would do in the hospital, similar to the surgery. But we have moved this type of procedure now to be done in the office. And now we're even able to do it with that twilight anesthetic as opposed to just a general anesthetic. Now, the GreenLight laser treatment is more aggressive than the Rezūm treatment because it's literally shrinking the prostate often over by 50% using a GreenLight laser beam. It's also done with the scope in the urethra, so there's no cuts or incisions anywhere. But instead of the procedure taking less than 30 minutes, it takes more than 30 minutes. There's usually not more pain or discomfort afterwards. But often the GreenLight laser, because we do shrink the prostate a lot more, We tend to do it for the bigger prostates, men who are more progressed in the enlarged prostate area, and it often lasts longer than some of the minimally invasive treatments. So if a patient had a minimally invasive treatment, after 5 years, they need another treatment, often we'll go to the laser treatment as the secondary treatment. There is some side effects with painful or frequent urination. Again, most of these side effects are the early on during the healing process of the laser. Urinary tract infections are more prone. The inability to urinate or completely empty the bladder, bleeding afterwards in the urine, urinary incontinence, which is very rare, scarring or narrowing of the urethra, which is a stricture that's pretty rare, narrowing of the bladder neck, which used to be more of a common with the older version of the GreenLight, but the newer one that's actually pretty rare as well. Dry orgasm. Now that does happen because we shrink the prostate so much, the semen volume goes down significantly. So this is a definite long-term effect where the ejaculatory volume is down. This does not affect the orgasm, does not affect the erections. It affects the volume of semen that comes out. So we'll see if you can watch this GreenLight laser, and I'm going to sort of walk you through it. Essentially, it uses this laser fiber. So this is placed through the scope while the patient is in that twilight sleep. Uses a wavelength of light that gives green light, so it does look green. And we use that wavelength because it absorbs into the hemoglobin or red cells inside the prostate, and that's what releases the heat in the prostate gland. And the temperatures are such that it literally vaporizes that part of the prostate in a very controlled fashion. And by doing that, that shrinks the prostate often close to 50% or more. The nice thing about the laser, because the vaporation is instant, the patient's prostate, there's not a waiting period for the shrinkage to happen. It's already shrunk by the time we're done with the procedure. And that's why there's more room now for the prostate to regrow without re-obstructing in the future. And often the GreenLight laser treatment can last 10, even 15 to 20 years in many cases. So this is sort of taken the place of the surgery that we used to do in the hospital all the time. And because this GreenLight laser can now safely be done in the office in many men, it really made this treatment much more accessible and easier for men to go through. However, if a patient is considered higher risk from anesthesia perspective or has a very large prostate, we may still do it in the surgery center setting or in the hospital setting. So that is what the GreenLight laser is like. Let's see here. So the other procedure that the GreenLight laser in my practice primarily took the place of this is the transurethral resection of the prostate, or the TURP. This is one of the oldest procedures of the prostate. We've been doing it for over 50 years, and it uses a heated wire to cut the prostate, almost like a apple peeling, but from the inside out with a scope. So there's no incisions. And this is done in the hospital, typically. We've been doing more of these with some newer TURP technology as an outpatient in a surgery center, but this is not done in the doctor's office. It is effective. This can last as long as the GreenLight laser, but it is a little bit more aggressive therapy. There is more bleeding risk with this. And as the similar side effects, painful urination, infection, the bleeding, incontinence can happen. The dry orgasm can happen. We definitely see more risk for erectile dysfunction and incontinence with this technology. However, when done in the right hands, it can be very effective. So it is a good treatment. But this is reserved again for the men with the much larger prostates. Okay, and then the prostatectomy. So this is literally making an incision in the abdominal wall and removing the prostate. Similar to doing the cancer procedure, but not quite as invasive. Now, this one's often done with an overnight hospital stay. You can do it as an outpatient, but most of the time, patients do spend the time in the hospital. And when we do this type of procedure, there's a much higher risk of leakage of urine and scarring and bleeding and the need for blood transfusions. So this is done when men are very obstructed and the prostate's very large. We waited too long. We've already skipped over those minimally invasive options because the prostate is too big to do those types of procedures. So this is something we would do in a patient with a very large prostate who is already having some serious obstructions. So insurance coverage for everything I talked about today is an FDA-approved treatment. It is covered through Medicare and private insurances. Now, private insurances do vary from insurance to insurance and how much they cover and what your deductible is and things like that. So it is important to contact your insurance provider. In our office, we do help you with that process because it gets a little confusing, but usually there's not an issue with insurance coverage with this. So in summary, what is the prostate and how does it work? Okay, enlargement of the prostate is BPH. Our treatment options are watching it in the very earliest stages and monitoring it. We usually do an annual prostate exam. We do this for prostate cancer detection, but we also monitor the size. And if we see that there's starting to become a blockage by doing those questionnaires that we ask patients to fill out in our office, scanning the bladder to see how well they're emptying, and maybe doing a flow study, have them urinate in that flow machine to see if they are beginning to obstruct. And then we start looking at those first line therapies. The medical therapy, which are the pills, often we'll try them unless there are side effects with them or patients are on other meds that we cannot give them those because there's interference with those meds. Then we go to the procedural type, minimally first line therapies. And this is Rezūm Water Vapor Therapy, where again, we do it right in the office, takes less than 30 minutes, often even 15 minutes to shrink the prostate. And that one-time treatment can last a patient for 5+ years often. And then we have the permanent implant option as well. And then if the patient has a bigger prostate and they may not qualify completely for some of the first line therapies, we go towards the GreenLight laser therapy, also done in the office, in our office, but it does take a little bit longer, a little bit more risk to it. So we reserve that for the larger prostates with more serious obstruction. And then the TURP, for very large prostates, and the prostatectomy are those that are at the point of almost complete blockage before we do that. Fortunately today, because we try to do a thorough job following our patients, I try to avoid the surgical options because I like to treat them sooner. But the GreenLight laser, I've moved that in my practice from the surgery group to the first line group just because we're treating patients sooner and we're able to do it in the office safely. So the next step that you have is evaluate your symptoms. And, the best thing to do is consult with your urologist. And at that point, it's very simple. Just go over your symptoms. Sometimes it's a good idea to write down your urinary pattern. It's hard to remember sometimes when you walk into your doctor's office and they're asking how many times you wake up at night and you really don't think about it all the time. But writing those types of symptoms down will help refresh your memory. So when you're looking and talking to your urologist, they can go over your symptoms and based on that, plus the exam, determine what treatment option is the best fit. There's not one treatment that fits everybody the best. Every patient's individual, the prostate size is different, their overall health status is different. So we customize the treatment to the individual patient and the prostate size. So any questions on the BPH?